We continue to see concerning trends for COVID-19 ahead of the winter season in the Northern Hemisphere. Deaths are increasing in some parts of the Middle East and Asia. ICU admissions are increasing in Europe, and hospitalizations are increasing in several regions. Globally, there is not one variant that's dominant. The variant of interest, EG.5, is on the rise, while the XBB subvariants are declining. The BA.2.86 variant has been detected in small numbers in 11 countries. WHO is monitoring this variant closely to assess its transmissibility and potential impact.
But this is in the backdrop of 3 variants of interest, EG.5 and 2 of the XBB sublineages. EG.5 is about 30% of the sequences that are globally. So this variant is not outcompeting any of the variants of interest right now or other variants that are in circulation, and this is what we're looking out for.
One of WHO's biggest concerns is the low level of at-risk people who have received a dose of COVID-19 vaccine recently. Our message is not to wait to get an additional dose if it's recommended for you.
What is really important is that those who are most at risk for developing severe disease receive a booster, receive an additional dose. Certainly, if you're in an older age group within 12 months, if you're in the oldest age group over 75, if you have multiple underlying conditions, the current SAGE recommendations are to be boosted within 6 months. And the vaccines that are in use continue to prevent severe disease and death, even with the new subvariants, the new variants that are being detected, including EG.5 and some preliminary data coming out suggesting that the vaccines will be protective against this new variant BA.2.86. So this is encouraging news. We are concerned about COVID, but we're also concerned about influenza and RSV. What we don't want to see are actions that only focus on one particular pathogen at the expense of others. And what we're doing for COVID is beneficial for flu, is beneficial for RSV.
First, to Sudan, where the humanitarian situation is continuing to deteriorate. About 65% of the population has no access to health services, and more than 70% of health facilities in conflict areas are not functioning. The implications are horrific. Every day, 9 patients with renal dialysis die, and dialysis centers in 4 states have closed due to lack of supplies. In addition to supporting 11 hospitals, WHO is now rolling out 12 mobile health clinics to provide life-saving and essential health services to people with no access. Now to Bangladesh, which is experiencing its most severe outbreak of dengue on record. Since the outbreak began in April, more than 135,000 cases and 650 deaths have been reported, including 300 deaths reported in August alone. The outbreak is putting huge pressure on the health system. We have trained doctors and deployed experts on the ground. We have also provided supplies to test for dengue and to support care for patients. Finally, to Nigeria, which is experiencing a severe outbreak of diphtheria. So far, more than 9,000 suspected cases have been reported across 17 states with 307 deaths. This is the second wave of diphtheria this year. Diphtheria is a highly contagious but vaccine-preventable disease caused by a bacterium which can be fatal in 5 to 10% of cases, with a higher mortality rate in young children. In response, WHO is supporting the government to improve vaccination, surveillance, case management, and risk communication.